Hello, and welcome to Lymphedema Treatment Act Public Comment Period Information Session. My name is Sarah Bramblett. I'm the board chair of the Lymphedema Advocacy Group, and today we're going to go over some information regarding the implementation of the Lymphedema Treatment Act. First, we're going to go over what the Lymphedema Treatment Act provides as far as what the legislation stated and what it will cover per the bill, and then we're going to discuss coverage details that we hope are in the proposed rule that the Centers for Medicare and Medicaid Services are soon to release. And then we're going to discuss how to submit a public comment, and then we'll go over how you can contact us if you have any questions. So again, just quickly, the Lymphedema Treatment Act was a bill that was passed in 2022. It was passed as part of a larger package called the 2023 Consolidated Appropriations Act. The Lymphedema Treatment Act creates a Medicare benefit category under Medicare Part B for the coverage of medically prescribed compression garments. The reason this bill was needed is because Medicare has defined benefit categories for everything that they cover, and lymphedema compression garments did not fit under any of those categories. Now, typically, a private insurance or other types of insurance might cover compression garments as durable medical equipment or DME, but Medicare defines DME has the durable part of it as longevity up 2 to 3 years. And we all know that compression garments do not last that long. They need to be replaced sooner than that. So for that reason, Medicare did not cover these items. Now, again, the bill is specifically for prescribed compression garments. We're well aware that other elements of lymphedema treatment, such as compression pumps or surgery or manual lymphatic drainage services, might not have adequate coverage everywhere. However, all those treatments do fit under a current Medicare benefit category, so we would not have needed an act of Congress to improve that coverage. So again, that is why the Lymphedema Treatment Act specifically is in regards to prescribed compression garments. Now, the coverage begins January 1st, 2024. The bill does state that standard fit and custom-made compressions are to be covered, and that coverage is for all patients with a diagnosis of lymphedema. Now, after the passage of this bill, we did start to collect questions, and we did compile a list of frequently asked questions that's available on our website. So feel free to look at that, and we'll include the link also in the email when we send this recording out. So I just wanted to show you how simple the bill language is when it comes to describing what is to be covered. As I stated in the previous slide, it's standard fit and custom fit gradient compression garments and other items determined by the secretary. So we wanted to keep this bill simple because anything that Congress passes, Congress would take another piece of legislation to make any changes. So we wanted to give the Secretary of CMS the ability to make any of those changes on their own. As perhaps new items come on the market, we don't want to have to go back to Congress and spend another 12 years, 13 years passing another bill. Again, it does state that the coverage begins January 1st, 2024. Some people, why do we have to wait a year? And anyone who works with the government probably understands this is a pretty quick turnaround time for a CMS to implement a completely new benefit category for coverage of items within a year. It does, number 3 does also state that who can prescribe these items. And then if you notice, it does kind of say prescribers might fall under to the extent of state laws, because different states might have different laws regarding who can prescribe items. So this is just a quick glance at the proposed rule or what it will be under. So just as the bill was passed under a larger legislative package, the coverage details for the Lymphedema Treatment Act are going to be part of a proposed rule, a larger rule under home health. And so at the time of this recording, the proposed rule has not yet been released, so we don't have the details of that, but we anticipate it being released very soon. And at that time, a 60-day public comment period will begin. And we hope that everyone who helped us get the bill passed will also help in commenting and making sure the coverage that CMS is implementing is the type of coverage we want. And so again, the coverage details that we hope will be included in the proposed rule include allowable quantities, replacement frequency and exceptions, access to custom-made supplies and compression garments, vendors and reimbursement rates, and coordination of care with other Medicare services. So we'll just quickly go over what we mean by each of these categories. Allowable quantities, so the number of garments allowed per order. The Lymphedema Advocacy Group had a listening session with CMS, and we emphasized that the number of garments a patient needs really depends on the patient's personal needs. It will depend on what area of the body is affected by lymphedema, the severity of lymphedema, the size and shape of that area of body, and just several other factors. So we just emphasize the treatment of lymphedema is very personalized. And so the number of garments a patient might need could vary. It could be a patient that has breast cancer related lymphedema and just needs a glove and a sleeve for one arm. It could be a patient that has lower extremity bilateral lymphedema, so they need a pantyhose or compression for each leg. Also, we emphasize that lymphedema can affect any area of the body, not just extremities. So there's head and neck patients, there's patients who have it in the abdomen, in the groin, in the chest. And depending on how many areas of the body a patient has lymphedema can determine how many garments they need per order. So we wanted to put in CMS's mind that any type of quantity needs to be by sets of garments and not per garment. So not like 2 garments, but 2 sets of garments, because people might need more than one garment be worn at a time to adequately cover all the areas of their body that have lymphedema. So next we spoke about the replacement frequency and exceptions. So how often can garments be ordered? Typically, it's been said every 6 months, you would need a new set of garments. Due to the durability and possible changes in measurements and frequencies, 1 year, some other, as we mentioned, these are typically under durable medical equipment. Sometimes it might say, once a year or once every 2 years. So we already corrected that. Once every 2 years, that's not going to be acceptable. But even once a year might not be adequate either, because changes can be made to the area affected. And so we know the standard of care right now is typically every 6 months. But we also mentioned that exceptions must be made for garments that require more frequent replacements. We've heard from patients who have upper extremity lymphedema who wear gloves that sometimes, due to the type of work they do, the gloves wear out sooner than every 6 months, and they need to replace them more often. Or perhaps someone has very severe or has some type of flare or has additional complications, and their limb is larger and needs replaced sooner, or additional, maybe they have some type of surgery and their limb is smaller and now their garment is too large. So we just wanted to make sure there's exceptions for patients who might need a more frequent replacement whenever they put this detail in. And again, just a reminder, I mentioned every 6 months. All this is what is typically stated now. We do not yet know what CMS will state in the proposed rule for coverage. Access to custom-made supplies and compression garments. Again, we emphasized that compression needs are individualized per patient. And although the bill does state that custom-made compression garments are to be covered, we wanted to make sure that they don't put any burdensome requirements for patients to access custom-made garments, such as needing to try a standard fit first. We know that Once a patient is reduced down to the size of needing a garment, if they are forced to use a compression garment that is not adequate for the containment or the size of their limb or area, it's just going to undo all that work of reduction. And it can be actually harmful for the patient's health to have to try that. So we emphasize the need for there not to be any burdensome requirements to get custom made. We understand they might want some extra documentation to show that a patient actually does need custom made supplies and garments. And we were told that might be determined by a national coverage determination or local coverage determination at another time. So when this proposed rule comes out, there might be mention of custom made supplies and garments, but there could also be additional upcoming information regarding any requirements to have those approved for payment. Vendors and reimbursement rates. So reimbursement rates need to be adequate so that vendors will supply the products. Currently right now, there's a lot of varying prices among private insurance reimbursements and costs for vendors. And that is because there hasn't been a set Medicare reimbursement rate. So once Medicare sets the reimbursement rates, it will provide some uniformity across insurance and suppliers. However, we have stressed that we want to make sure those reimbursement rates are adequate so that vendors will want to supply these products to patients. It does us no good to have coverage for products and then not have any vendors or suppliers able to provide these products for the patients. And then I also wanted to touch on reimbursement rates. And when I mentioned Medicare allowable cost for these items. So again, this is going to be a benefit category under Medicare Part B. And so it will have the same patient responsibility as every other item under Medicare Part B, which is 20%. So Medicare will pay 80% of the cost, and a patient will be responsible for 20% of the cost. Now, of course, that is the standard Medicare reimbursement setup. If you do have a supplement or secondary insurance that often picks up that extra 20% for you, that likely will be the case with this benefit category. All those details, of course, haven't been determined yet either. We also hope that several states have a Medicaid that do provide coverage for these compression garments. So we hope that it will work well with the Medicaid programs and picking up any additional costs that a patient would have responsibility for. And the final area that we discussed with CMS during our listening session is the coordination of care with other Medicare services. One of the questions CMS did have for us or was interested in knowing is, how do patients typically get compression garments? And like what type of environment? Do they just go somewhere and buy them, or are they ordered? So we explained that it, again, like every other aspect of lymphedema treatment, it's personalized to the patient and where they are in their treatment. So a patient initially gets diagnosed with lymphedema, sees a occupational physical therapist or certified lymphedema therapist for treatment to reduce the limb. And then at that time, that therapist would typically advise what type of garment to get and help the patient place an order through a supplier or vendor. However, once the patient is maintaining the lymphedema on their own and they just need to replace their garments, they might not need treatments from an OT or a PT. They just need to go in somewhere and be measured by a fitter and order new garments. And so that just might be at the location of the vendor or the supplier. So it can vary. But there's also times, so that would be an outpatient clinic, if they're receiving physical occupational therapy. But there are times now where some patients are getting home health care. They might be in inpatient rehabilitation or skilled nursing facility or living in a nursing home. And sometimes with those other types of environments. So an outpatient clinic is also under Medicare Part B. So that's likely already, something, both of the benefit categories under the same type of rules. But for example, home health is a Part A benefit, and they have certain rules of how they interact with providing services, and maybe when or how they access the Part B benefits. So it's not something we knew a lot of the details about, but we just wanted to put it on the radar of CMS that patients with lymphedema can receive care in various types of environments, and we want to be sure that they can access this new benefit no matter where they are receiving care. And now to the public comment period. And again, at the time of this recording, the proposed rule has not yet been published, but we just want to make everyone aware of what the public comment period is. And so again, it'll be once the proposed rule is published, there will be a 60-day period where the public can comment on the proposed rule and the coverage details. The LTA is going to be part of that larger home health rule. Comments can be supportive and or critical of the proposed rule, and all comments will be read by CMS. They do, have a human reading all the comments and documenting them. And so for that reason, quality is more important than quantity. We do hope as many people as possible will submit a public comment, but we want to make sure there's quality in those comments. And that is a reason we will not be providing a template for people to submit. If you've been helping us, get this bill passed, we often provided a template email for you to send to your members of Congress. And because typically a congressional office actually does tally the number of people they hear from regarding a topic. But that is not how the public comment period will work with CMS. And so we are focused more on the quality, and that's why we want to provide as much support in helping people compose their comments. And there will only be one comment allowed per individual or entity. So organizations can submit comments, and then individuals can submit comments. So like example for myself, the Lymphedema Advocacy Group will likely place a public comment on behalf of the entire organization. And then myself as a patient and individual, I can put one specifically from me and my personal experience. So I've pulled together a few tips for submitting effective comments, and these did come directly from the regulations.gov website. And we do have them put together in a document that we will share when we share the email of this recording. So again, a comment can express simple support or dissent for regulatory action. However, a constructive, information-rich comment that clearly communicates and supports its claim is more likely to have an impact on the regulatory decision-making. So for a patient, the information-rich comment is likely going to be your personal experience and how the proposed rule is either going to help or, if there's something about it that it's not going to be helpful for you. But again, the purpose of the public comment period is to help them shape this proposed rule, which is a draft of the rule, help make sure that if there's any changes that need to be made before they create a final rule, that they are made. We're well aware that even the final rule might not be perfect, but we wanted to make it the best it can possibly be when it's finalized. So be concise and supportive of your claims. So as I mentioned earlier in this presentation, there are a lot of other coverage issues and access to care issues that lymphedema patients have, all the way from timely diagnosis to getting other types of care. We want, again, to focus on the implementation of Lymphedema Treatment Act and the details that are in the proposed rule. You want to base your justification on sound reasoning, scientific evidence, and or how it will impact you. As a patient, we have links to some of the research that we used, but as a patient, as a provider or a therapist, that personal experience is going to be what is going to be that justification. So if you're a patient and just your personal experience of what your needs are with compression, that's going to be impactful. You don't need to worry about pulling up scientific data to back up your own real world experience. It's that real world experience that is going to be impactful. There's no minimum or maximum length for an effective comment. We have been asked if there is, and like how long you can make it. Not only can you, there's no maximum length, you can also add attachments. So if there are any, if you're a provider and you're wanting to add some scientific evidence, you can provide links to articles whenever you submit a comment. And again, the comment process is not a vote. One well-supported comment is often more influential than 1,000 form letters. And that is why we are not going to provide form letters. We will provide guidelines on how to compose your comment, but we will not have a template for you to just add your name to and hit send. So clearly identify the issues within the regulatory action on which you are commenting. This is going to be very important since the implementation of the Lymphedema Treatment Act is part of that larger proposed rule. You need to identify that you're commenting on the lymphedema coverage, and then they even suggest being more particular and citing which phrase, page number, or paragraph that you are referring to with your comments. But you do not need to comment on every aspect of the coverage. If, say, only the information regarding quantities affects you, you can just make your comment about the allowable quantities that the proposed rule has. If every aspect of the rule does affect you, you can certainly comment on all of them. But again, consider including examples of how the proposed rule would impact you negatively or positively. When should you submit a comment? As soon as the proposed rule is published, we, the Lymphedema Advocacy Group, will notify everyone. If you need to sign up for our newsletter, we will have that link on the last slide. But we will send out an alert that the proposed rule is published. We will provide information regarding what is included in the proposed rule, and then we'll also have an action alert where we will have a streamlined submission process set up for you. Again, you'll still need to write your own personalized comment, but we will have guidelines and information to help you do so. There's no rush. It's better to take your time to compose an effective personalized comment than to submit it quickly. A comment submitted on day 60 will still count as much as a comment submitted on day 1. And again, if you need help composing your comment, we will provide guidance for comments in the action alert. So you need to make sure you're signed up for our newsletter so you get that information and you'll know when the public comment period has started, the proposed rule has been published. You can contact with any additional questions or ask us for additional assistance at info@lymphedema-treatmentact.org. And as I mentioned at the beginning of this presentation, we have compiled a list of frequently asked questions regarding the Lymphedema Treatment Act coverage, and that is available at our website at lymphedema-treatmentact.org/FAQs. So that ends our presentation today. I want to thank you all for taking the time to listen to this presentation. I want to thank you again for your advocacy work that has helped us reach this monumental accomplishment for lymphedema patients. And again, our goal is to make sure that the new coverage is as well intended as we wanted it to be, and that's why we hope that you will participate in the public comment period so we make sure that patients' voices are heard and we get the type of coverage that we have fought so hard to get. And thank you again, and keep a watch in your inbox for our action alert. Thank you.